Special Needs Expo March 14th at Link Point on the UCP campus.
And welcome back to Talk of Alabama. Joining us now is Dr. Kathryn Turman, a physical therapist at the Doleys Clinic here in Birmingham. Now, she specializes in complex pain evaluations and women's health. So welcome to you, doctor.
Thank you. Thank you.
So we're talking about chronic pain here, which really affects millions of people, right?
Yes, it does.
So how do you help when people come into you with this kind of chronic pain?
Well, what we do is new patients are admitted to our clinic and they see a psychologist and a medical physician first, and they are screened for their activity levels or their exercise levels. And if they are leading a very sedentary lifestyle or very limited in their functional mobility or not currently participating in an exercise program, they are referred to me to develop an exercise program. And this is helping the patients take a more active role in managing their chronic pain.
I bet. What type of physical therapy services do you offer?
Offer those that are typical of your outpatient physical therapy clinics, such as exercise or manual therapy techniques, to do some education, modalities, gait training, balance training. So very similar of your typical outpatient physical therapy clinic, but a little bit more specialized to the chronic pain population.
I was going to say, what could people expect if they're at home watching right now and they're dealing with chronic pain? What can they expect when they come in there?
Well, first I take a history of the events that has led to their current condition. I perform a pretty thorough musculoskeletal exam, and I talk about any specific goals that the patient may have, something that they want to work on specifically. We next develop a home exercise program that helps these patients address their specific goals and address their specific limitations. Now, some people I see only one time to develop a home program, and then they take that and they work on that themselves. Other patients could benefit from some regular physical therapy sessions, and they're better candidates to see long term. And I'll see them typically once, sometimes twice a week for in-clinic sessions to work towards any specific goals they have.
And then how do you measure the success as you're going through this process of physical therapy at home and at the clinic?
Well, pain relief is not always a goal when I'm working with chronic pain patients. Our primary focus is to help these patients improve their quality of life. So we have very functional goals. Let's say I'm working with a patient with some chronic neck pain who's complaining of increased difficulty with driving, or it's interfering with their desk job. We're working towards these goals, and they may come back and say, wow, my headaches are less frequent and less severe, and that's just a bonus. Or I could be working with a patient with low back pain, and we're trying to improve their standing tolerance so that they can prepare themselves a meal or wash some dishes, and they may come back and say, I was actually able to sleep in my bed for the first time in a couple years, when they're used to sleeping in a recliner every single night. So pain relief is often achieved, but we're really focused on improving their quality of life.
And how do people get more information if they want to talk to you specifically or contact the Doleys Clinic? How do they do so?
Well, they could leave a message for me, and I'll get back to them. Now, I can see any patient, not just patients of our clinic.
Very nice.
The only thing required to come and see me is a prescription from their treating physician. And I see a wide variety of patients with orthopedic neuromuscular problems, but I also have a special area of interest in women's health, and this includes women who are suffering from bladder dysfunction or interstitial cystitis, pre-postpartum complications, endometriosis, or problems from pelvic floor dysfunction. So that's another area of work I do, that I see a lot of patients that are not full-time Doleys Clinic patients.
And you are a very busy lady.
Very busy, very busy.
Doctor, we appreciate your time.
Thank you very much for having me.
Of course, the doleysclinic.com. You can call the number on your screen, go to the website, and you can specifically ask for her as well. Thank you so much for being here.
Thank you.
Okay, we've got to send it over to the kitchen.
And we're making a slaw, right?